Hi, my name's Kim.
And I'm Sammy. We're here from the Ohio State University College of Dentistry. Because there's a limited time available before your patients arrive, we'll try to make this really quick.
For our community class in dental hygiene, we completed our needs assessment here prior to this, as you remember, and we would now like to present and discuss some of our thoughts of how to better the dental care program here.
During our needs assessment, we realized that the program here needs little to no improvement. So it was really hard coming up with stuff, but we came up with a couple of additional objectives and ways to achieve these.
Because there's no computer access, we provided you all with paper copies of the PowerPoint we're presenting.
Kim's going to pass those out for you guys.
There you go. You're welcome.
Alright, so you guys have your copies. Our goal today is to enlighten you with some different ideas of how to achieve certain objectives that include increasing patient numbers to 15% or by 15%, increasing patient education within a year,
showing the state that more room is needed to operate because of the increased patient numbers, increasing the amount of visual aids in general around the site, and incorporating an oral health class within the next 3 years.
A lot of the information we gathered has been from a document written by the World Health Organization dealing specifically with dental health in the prison population. In order for this program to be effective, we need to prove to the prisoners that dental health is just as important as all over health and that there's a connection and systemic links between the two.
One of the topics in this PDF that we found was substance abuse. This is a high risk factor for both tooth decay and periodontal disease. We thought that some of the inmates here could fall under this category and need to be informed of the different risks.
Prisoners in general have a greater need for oral health care due to the fact that many were unemployed before they were in prison, so they didn't have access to care or to the dental care beforehand. According to the World Health Organization, 50% of prisoners are likely to be unemployed before sentencing and enter prison with poor oral health.
Many prisoners also have low levels of literacy. To compensate for this, we decided that a video and different language pamphlets should be incorporated within health education. With us today, we brought a poster you may hang up for the inmates to observe, and we printed out some oral hygiene instructions and information sheets that are available in different languages. We did this to help reach out to those who may be illiterate or to those whose primary language is not English.
Since this facility is 100% women, the World Health Organization states that pregnant and nursing mothers should be granted full range of treatment. We weren't sure if this was already incorporated into the program, but we thought that it would be a good addition if it wasn't.
For oral health promotion, the World Health Organization listed many different models of good practice. The idea that we thought would most benefit this population is a program that rewards the inmates for completing a smoking cessation program with a complimentary pro-fee. This entices people to stop smoking, which lowers the risk for periodontal disease, and also provides that extra benefit of a cleaning.
Our final idea to help the program would be to implement a class that the inmates could take. We remember from the last time that inmates are allowed to take classes during or while they're in prison, so we thought that a class would be appropriate. All forms of media could be used in making this class, including some of which we've already provided you.
Before entering and upon completion of this class, the inmates could be given a plaque score, like the plaque control record, to measure if there is a difference in the oral health of the patient and to see how much they've learned throughout the course.
To conclude our presentation, we hope that you've gained new knowledge and that you can use it to better the facility's dental health care program. We'd like to thank you for your time.
And does anyone have any questions?
Yes? You in the middle? Uh-huh. Yeah.
Actually, can you repeat that last part real quick? Okay. Yes. Oh, all right. Okay.
So for those of you who didn't hear the question, it was what types of topics could be presented in the class that we suggested you guys present?
And to answer this, you could present numerous topics of oral health such as gingivitis, periodontitis, OHI, caries prevention, substance abuse, and you could even go into detail about some different procedures they would go under.
And if you guys don't feel comfortable presenting the information, you could always talk to the state or whoever, like the director of the program, and see if the facility could maybe provide you with an educator who can teach this class.
And that was a very great question. Thank you for asking. Are there any others?
No?
No?
Okay, thanks again. Please keep in touch with us so we can see how it's going and help you if you need anything. Thank you.
Thanks. Hi, my name's Kim.
And I'm Sammy, and we're here to present a topic to you about different needs of prisoners.
Ready?
Okay.
Representing.
Kim will pass this out for you guys. Okay. Okay. Our goal today is to enlighten you with some different ideas of how to achieve certain objectives that include